Hi, my name is Amy Manning. I'm a family nurse practitioner student at Frontier Nursing University. Today I will be discussing an article titled Supporting Cardiovascular Risk Reduction in Overweight and Obese Hypertensive Patients Through DASH Diet and Lifestyle Education by Primary Care Nurse Practitioners. The study discussed in this article was a pre- and post-intervention quasi-experimental time series design, which represents a level 3 in evidence. The article was found in the Journal of the American Association of Nurse Practitioners, a scholarly, peer-reviewed professional journal that is published monthly online. The purpose of the study was to evaluate a nurse practitioner-led education program, including instruction in the dietary approaches to stop hypertension, or the DASH diet, along with other lifestyle education, and its effectiveness on the health of overweight or obese hypertensive patients. Originally, 45 patients consented for the study. However, the final sample that completed the educational program consisted of 26 adult participants. 12 of these were males and 14 were females. The inclusion criteria required the participants to be adults, overweight or obese, have a medical diagnosis of chronic hypertension, and have access to a phone to complete the counseling sessions. Prior to its implementation, the study was reviewed and approved by the Navy Medicine West Institutional Review Board. This board ensured that this study was in compliance with federal regulations, which ensured the protection of human research subjects. The setting of the study was a single family medicine clinic. This allowed for consistency in the application of the educational program. The study took place between September 7th and November 2nd of 2011. Methods that were used in the study included the Rapid Eating Assessment of Patients, or the REAP tool, and the Partners in Health Assessment tool. These were administered pre- and post-intervention to assess the patient's self-reported diet and exercise habits. BMIs were also calculated on all patients, both pre- and post-intervention, to be used for comparative purposes during the study. The education program provided focused on the DASH diet primarily, but also included other lifestyle education. The nurse practitioner implemented the program in 3 group classes, along with 2 individual counseling telephone calls, all of which were conducted over the 2-month study period. The educational materials that were used during these sessions were compiled from the National Heart, Lung, and Blood Institute, and these were all distributed to the participants in packets. The results of the study demonstrated improvements in multiple areas. The average scores of both the REAP and the PIH increased significantly. The REAP score reflected an improvement in the participants' sodium intake, meaning that they decreased their intake, and an increase in their physical activity level. The PIH score increase demonstrated a greater level of self-reported knowledge and self-efficacy in regards to the patient's ability to manage their health. The other positive result of the study was that 77% of the participants lost an average of 3.6 pounds during the course of the 2-month study. There are various implications for primary care practice found within the study. First, the study demonstrated that evidence-based practice can improve clinical outcomes in the primary care setting. Second, a DASH diet education program can be successfully conducted over a 2-month period, as seen within the study. Third, although the DASH diet was the focus of the educational program, other areas of improvement were also seen in areas such as the increased level of physical activity. This demonstrates a greater understanding of self-management of hypertension as well on the part of the participants. A fourth implication for primary care was the demonstration of short-term success in patients that chose to participate. The study gave an example of how an NP-led DASH diet educational intervention can be successful in helping motivated, overweight, and obese hypertensive patients improve their health status. There were limitations to the study. These included a small sample size and the lack of long-term evaluation of the intervention. The researchers did state that follow-up assessments are planned for the future. This concludes the presentation. This is the reference that was used and thank you for joining me.